Imagine a healthcare system that meets you where you are.
In my school.
In my neighborhood.
In the moment I needed help the most.
That's what we're building.
That's what we're building.
That's what we're building
here at Cambridge Health Alliance.
Cambridge Health Alliance is a community healthcare system. It's reimagining the future of healthcare.
The largest provider of inpatient child and adolescent psychiatry services in Massachusetts.
And a Harvard teaching hospital that thrives on innovation.
Teaches medical students how to become excellent physicians.
We're focused on meeting people where they are and using technology in the right way.
And providing the services that people need most throughout their lives.
I think often in medicine, something that happens is that patients can become diseases or diagnoses or problems that you need to fix. When you understand a patient as just a human being and having lives outside the four walls of the hospital and outside of the 30 minutes that you get to spend with them in the hospital or patient encounter, I think that's when medical care and true care comes to life.
Cambridge Health Alliance is a Harvard Medical School teaching hospital, and in that way, it is deeply committed to excellence in education and excellence in care delivery. Traditionally, medical education in the clinical year has been blocks or rotations or clerkships, we call them. You can imagine a different model where the students did medicine for the entire year and surgery for the entire year and psychiatry for the entire year, all the disciplines for the entire year, they and their patients for the entire year.
So I really wanted to be able to be trained in a way where I can be a physician that really knows my patient as who they are, what they love to do, and what their goals and their dreams are, rather than just being, medical cases. Being able to put yourself in the shoes of a patient is being able to meet them where they're at.
The education system and the healthcare delivery system that I imagine for the future is one that is deeply scientific and deeply humane. When you change to longitudinal design, the patient becomes the organizing principle rather than discipline or place.
That is what made the integrated clerkship special, is that we were able to see people actually get to the end of chemo or get that surgery they really needed or have that baby that you don't really get to experience in any of the other hospital sites.
Patients don't end at the end of some course. Caring doesn't end at the end of some course. The students should go where the patients have the need, and the students should go where the faculty are most able to teach them. That relational continuity is the power of the Cambridge Integrated Clerkship.
We are in the midst of a mental health crisis for youth. They're seeing more and more of their friends struggle.
I think with school, with work, with our home life, it's just a really hard mixture.
Youth today have to contend with things that other generations didn't really have to.
With social media, it just makes it even harder because you can't really talk about your bad experience because you're scared of feeling judged.
There can be a lot of shame around having a mental health condition. And sometimes there is this sense that even if I recognize that I have a problem, that I should deal with it on my own.
We think of mental health issues as a bad thing, and that leads us to think that I don't have help, I don't have the resources.
It's so important for youth to get appropriate care during times of struggle or during times of crisis. At Cambridge Health Alliance, we are offering a wide breadth of youth mental health services to ensure that patients are getting access to care at the right time.
One great thing is that CHA has the Everett Teen Health Center where teens can go for any issues they have. And I think that's a really good opportunity for students because if they're ever curious and need a professional spokesperson, then they'll be able to find them.
When we make investments in youth mental health, we are making a commitment and an investment in our future. When I see one of my kids graduate from high school, or go off to college, get their first job. They're contributing to society, they're succeeding, they're flying. That's what they're doing. And it gives me such joy And I feel such pride to be a part of those journeys. And that's why the investment is so important.
Our focus at CHA is on the care that our communities need every day. And technology can really augment that by increasing access, increasing the highest quality and delivery of care to our communities, and expanding the outreach of that care.
I love to think of technology as a human amplifier. If we can take some of the things that you consider, your administrative burden, and we can just reduce that or use technology to achieve that, then we leave our wonderful, spectacular, talented caregivers with more time to have that interaction, to understand what the patient is bringing to them, what's concerning them today, what are their health concerns.
One of the ways that we can improve clinical care is by identifying our patients that need care in certain situations, and our technology systems can help do that.
So when we think about the care that our patients need, primary care, behavioral health, caring for the whole patient, we are at a point now where we've got all this information at our fingertips, and we're going to be able to personalize that care based upon you.
We can even go a step further to use predictive algorithms to understand which patients are the most at risk and target certain interventions for those patients. All of this helps us to provide the highest quality care to those who need it most.
Now we're going to be able to take all of your characteristics and use the advancements in technology to actually say, this is the care that's going to help you get better the fastest, for you to live your healthiest life. So that personalized care at scale, it's at our fingertips, and it's what the future of healthcare is. And I'm so excited to be here about to launch into it.
The technology is moving so fast, and we here at Cambridge Health Alliance are using it in so many different ways to improve communication, to improve efficiency, to improve access to care, to improve quality and safety in the care we deliver, to improve equity. But at the end of the day, it's all about improving people's lives here at CHA.
We imagine care designed around people, not obstacles.
We imagine a system that improves and saves lives by engaging people where and when they're ready to accept treatment.
We imagine people like you supporting the only public hospital in Massachusetts.
We're delivering what matters most while reimagining the future of healthcare.
We're building that future.
We're building that future.
Help us continue to innovate and make a difference.